Good morning, everyone. My name is Jonathan Goldberg. Good morning, Gloria. Today, I'm one of the physical therapists here at St. Andrew South in the LEC, and today's topic, I'm going to be discussing pain, but more other approaches to pain, holistic-wise, not just using medication. So objectives, I'll discuss acute pain versus chronic pain, holistic approaches such as acupuncture, physical and occupational therapy, exercise, massage, stress reduction techniques like yoga, tai chi, and aloe vera. And I will also touch on CBD, such as the benefits, side effects to it, safety, and concerns about CBD. And of course, at the end, to make time for questions. So what is pain? So pain occurs when something is hurt, causing an unpleasant or uncomfortable feeling. When pain is present, it usually means that something is wrong. The best judge of pain is you. There are two types for the purpose of this presentation I'll be discussing. It's acute versus chronic. So acute pain happens quickly and goes away when there's no cause, but chronic pain lasts longer than 6 months and it can continue when the injury or illness has been treated. So acute pain comes on quickly and it's caused by something specific. The quality of the pain is sharp. This type of pain doesn't usually last longer than 6 months. It goes away when there is no longer an underlying cause for the pain. Causes of pain can include surgery, broken bones, dental work, burns or cuts, labor, and childbirth. Chronic pain is pain that is ongoing and usually lasts longer than 6 months. This type of pain can continue even after the injury or illness that has caused it has healed or gone away. In the nervous system, pain signals remain active for weeks, months, or even years. Chronic pain is linked to conditions such as headache, arthritis, cancer, nerve pain, back pain, and fibromyalgia. So chronic pain produces physical conditions such as tense muscles, a limited ability to move around, a lack of energy, and changes in appetite. Some emotional effects that chronic pain produces include depression, anger, anxiety, and a fear of re-injury. This fear can limit your ability to return to work as well as leisure activities. So the first one, of course, I'll talk about is physical therapy. So most people who experience chronic pain cannot imagine that any activity or exercise could be useful, but top management pain specialists recommend PT as a viable solution to conditions such as fibromyalgia, nerve pain, chronic headaches, and osteoarthritis. So chronic pain usually ends up causing a reduction in regular activities, which in turn weakens the patient, making it harder to resume their normal lifestyles. PT is commonly misunderstood as being only exercise for injuries, but there are many other methods that can be employed, such as massage, manual therapy, or biofeedback. PT can be employed alone or as part of a larger solution for chronic pain and illness, with or without the use of pain management medication, and can reduce the instances of re-injury while improving the patient's mental outlook by keeping them active. Occupational therapy, also called OT, is often used interchangeably with PT, but they are two distinct disciplines. OT can include physical exercises, of course, but also helps foster independence by employing adaptive techniques and equipment that allow patients to do as many of their essential life activities as possible. Through the use of advanced training, OTs can also help patients learn strategies for improved memory function and cognition, while also keeping the body and brain young and active. Acupuncture. So this involves the insertion of very thin needles through the skin at strategic points on your body. A key component of traditional Chinese medicine is that acupuncture is most commonly used to treat pain. It is actually being increasingly used for overall wellness, including stress management. The traditional Chinese method of acupuncture is that it is a technique for balancing the flow of energy or life force, known as qi or kui, believed to flow through the pathways or meridians in your body. By inserting the needles into these meridians, the acupuncture practitioners believe that your energy flow will rebalance. Western practitioners, in contrast, view the acupuncture points as a place to stimulate the nerves, the muscles, and the connective tissues. Some practitioners believe that this form of stimulation boosts your body's natural painkillers. Exercise. So this is one of the most important ways to improve your overall health and often manage the pain. No matter how much pain you are in, there's almost some type of exercise you can do. Even if it's something just as squeezing your hands, doing ankle movements such as ankle pumps in your bed. So you find small exercises to do, either lying down or in a sitting position if you have limited mobility. Remember, start small and go slow. Some good examples of exercises for those with chronic pain include walking, swimming, Pilates, Tai Chi, yoga, and strength training. As always, talk to your doctor, a physical therapist, an occupational therapist, and/or a personal trainer about what is best for you. So massage has proven to be beneficial for chronic pain conditions. In addition to helping to relieve pain by relaxing painful muscles, tendons, and joints, massage can help decrease stress and anxiety, which can increase pain. The different types of massage styles include Swedish, deep tissue, sports, shiatsu, trigger points, and reflexology. Aloe vera. So natural aloe vera actually contains more than 200 biologically active constituents, including calcium, chromium, copper, iron, magnesium, manganese, potassium, selenium, and zinc. Aloe vera's nutrients, as well as the anti-inflammatory and analgesic qualities, may be helpful in relieving muscle and tendon pain. Aloe vera gel is sometimes used topically in sports medicine to soothe achy muscles, but taken orally, the anti-inflammatory ingredients may also help with pain. Okay, so Tai Chi, it's the low-impact, slow-motion, mind-body exercise that combines meditation, breath control, and movements to stretch and strengthen muscles. This practice goes back thousands of years. Body posture and deep breathing are key elements of doing correct Tai Chi. Attending regular ongoing Tai Chi classes provides the most benefits. Physically, Tai Chi supports or improves balance, coordination, flexibility, muscle strength, and stamina. Mentally, Tai Chi helps relieve stress, improves body awareness, and when done in a group setting, reduces social isolation. So there's been solid research that shows Tai Chi can benefit those with osteoarthritis, rheumatoid arthritis, fibromyalgia, tension headache, and other ongoing painful conditions. There was one trial of 66 people with fibromyalgia who were randomized into two groups. One took Tai Chi classes twice a week, and the other group attended wellness education and stretching sessions twice a week. After 12 weeks, those in the Tai Chi group reported less pain, fewer depression symptoms, and better sleep than the control group. These results were published in the New England Journal of Medicine. So yoga is a mind-body exercise practice that combines breath control, meditation, and movements to stretch and strengthen muscles. Yoga, like Tai Chi, has been around for thousands of years. So the difference between yoga and Tai Chi is the execution. In yoga, it's performed with holding the poses and postures, while Tai Chi is done in the more dance-like martial arts form. Both can be rigorous or low impact, depending on the person's fitness level. Yoga, like Tai Chi, can help with people with arthritis, fibromyalgia, migraines, low back pain, and many other types of chronic pain conditions. So a study that was published in the Annals of Internal Medicine found that among 313 people with chronic low back pain, a weekly yoga class increased mobility more than the standard medical care for the condition. Another study that was published at nearly the same time found that yoga was comparable to standard exercise therapy in relieving chronic low back pain. In a broader perspective, a meta-analysis of 17 studies included more than 1,600 participants concluded that yoga can improve daily function among people with fibromyalgia, osteoporosis-related curvature of the spine. Practicing yoga also improves mood and psychosocial well-being. Yoga can be performed in a chair rather than the floor if you have any limited health problems that prevent you from going on the floor. And of course, the latest is now cannabidiol, also called CBD. So this is the chemical that's found in marijuana that doesn't contain THC, which is the psychoactive ingredient that's found in marijuana that produces the high. The usual CBD formulation is oil, but it's also sold as an extract, a vaporized liquid, and an oil-based capsule. Food, drinks, and beauty products are amongst the many CBD-infused products available online. Epidiolex, which contains a purified form of CBD that is derived from cannabis, was approved for the treatment of seizures that are associated with Lennox-Gastaut syndrome or Dravet syndrome, two rare and severe forms of epilepsy. This is only available with a prescription from a licensed healthcare provider. What this means is that the FDA has concluded that this particular drug product is safe and effective for its intended use. So CBD is readily obtainable in most of the United States, although its exact legal status has been in flux. All 50 states have the laws legalizing CBD with varying degrees of restriction. So in 2018, when the Farm Bill was created, this made hemp legal in the United States, which basically means that it's virtually impossible to keep CBD illegal. It would be like making oranges legal, but keeping orange juice illegal. So all hemp-derived products were removed from the Controlled Substances Act, which criminalizes the possession of drugs. What this means is that CBD is legal if it comes from hemp, but not if it comes from cannabis, also called marijuana, even though it's the exact same molecule. Currently, many people obtain CBD online without a medical marijuana license, which is legal in most states. So benefits. So reports or research that has been done in humans as well as animals have shown that CBD may also help with anxiety, even though clinical trials are still going on to see the effect CBD has on reducing anxiety. Insomnia. Studies suggest that CBD may help with falling asleep as well as staying asleep. Addiction. So CBD can help lower the cravings for tobacco under certain conditions, according to some research done in humans. Animal or non-human models of addiction suggest that it may also lessen the cravings for alcohol, cannabis, opiates, and stimulants. So, is it safe? So, the side effects of CBD, most common ones actually, are nausea, irritability, and fatigue. So CBD can increase the level of blood thinning and other medicines in your body by competing for liver enzymes that break down these drugs. High doses of CBD may show abnormalities in liver-related blood tests. Many non-prescription drugs, such as acetaminophen or Tylenol, have the same effect. So concerns. A safety concern with CBD is that it is marketed primarily and sold as a dietary supplement, not a medication. So the FDA does not regulate the safety and purity of the dietary supplements. You cannot be sure that what the product you buy has the active ingredients at the dose listed on the label. In addition, that these products that you're buying with CBD may also contain other unknown elements. Since this is still fairly new, we don't know what the most effective therapeutic dose of CBD is for any particular medical condition. So if you bought one of those drops at a pharmacy, it comes with the little tinker. So when you pull it out, you don't know if they say one drop is just one little drop or one whole squeeze. And they don't say exactly how much you should be putting in each little tinker. So if you do end up trying CBD, make sure you're getting it from a reputable source. As always, talk with your doctor to make sure that it won't affect any medications you currently take. Okay, so just want to show a brief video. It's not too long. So this is CBD for chronic pain in last year, 2020.
To buy the best CBD cream for pain relief? From CBD lotions and creams to CBD salves and serums, hemp for pain relief appears to be the latest trend in healthcare and skincare. In fact, if you do a quick search online to find the best CBD cream for pain relief, the choices seem unlimited. You can purchase CBD topical for chronic pain relief. Buy CBD topical for severe back pain. Buy CBD topical creams for severe arthritis pain. So with so many choices, two things come to mind. 1. Are these CBD creams truly effective? 2. What does best CBD hand cream for pain actually mean? Best price? Best CBD? Research says, yes. But quite frankly, it depends. Because everyone responds to CBD differently, and you can expect a different result based upon dosage as well. Plus, it's a buyer beware situation, due to the explosion of CBD-containing topical products using sub-par CBD oils that have not been adequately lab-tested for purity, potency, and bioavailability. Short for cannabidiol, CBD is one of more than 100 cannabinoids in the commercial cannabis indica plant. Because of the supposed health benefits like CBD cream for pain relief, you can now find CBD in food, drinks, creams and a massive assortment of other products. By definition, CBD products contain no more than a 0.3% concentration of THC, which is the part of the marijuana plant that gets people high or stoned, thus CBD products won't cause a high feeling. How are best CBD creams and topical CBD products used? One of the biggest uses for CBD topical creams is for musculoskeletal complaints. A 2019 report from the Arthritis Foundation found that 79% of the patients surveyed had considered using CBD or had already used it. 29% said they currently used it for arthritis symptoms. Among those using CBD, 55% used a CBD topical applied to the joints. Eileen D. of Air, Massachusetts, reports using CBD lotion. She has been suffering with osteoarthritis, and she tried a variety of other oils and pain-relieving patches without relief. Then she picked up a jar of the best CBD cream for pain and started to apply the CBD lotion to her joints about twice a day. And she found relief. I'll put it on and walk away and think, I don't have any pain, she says. Plus, topical CBD products are geared to help people with eczema and psoriasis. You will also find CBD showing up frequently in cosmetics and skin care products. These products may claim the combination of CBD with the other ingredients fights skin aging or that they are anti-inflammatory. CBD topical creams for pain can actually help address pain or inflammation that's located at a specific spot of your body, such as on the joints, or to cool inflamed and itchy skin. Topical CBDs don't cross the blood barrier, so they are not designed to address systemic problems. The best CBD topical actually can make the pain go away for a certain time period. This happens because CBDs are known to block chronic pain receptors on the skin. Cannabinoid receptors are part of the body's endocannabinoid system, a body-wide system discovered in the 1990s that affects many important functions. The chemicals produced by the body that interact within the EC system are called cannabinoids, and like THC and CBD, they interact with cannabinoid receptors. Research done by Halpert, in collaboration with the company Medterra CBD in Irvine, California, has found that CBD is able to turn down the production of inflammatory markers like tumor necrosis factor alpha, which is made in overabundance by people who have conditions like rheumatoid arthritis. Another study published in the journal Pain in 2017 found that prophylactic treatment with CBD stopped pain and hindered the development of more pain in rats with osteoarthritis. In a small study published in 2019 in Clinical Therapeutics, a CBD ointment used over 3 months for psoriasis, atopic dermatitis and scars significantly improved symptoms and signs of the skin disorders. Are CBD topical product legal? Pure CBD products are legal in the United States and many other countries as well. They can be bought online and sent through the mail, or bought locally at a medical marijuana dispensary and some health food stores. In addition, CBD is not currently regulated by the FDA, and the only CBD-containing product approved by the FDA is a drug to treat epileptic seizures in those with Lennox-Gastaut syndrome or Dravet syndrome. Purchase the best CBD cream for pain relief. Here are a few tips, tricks and inside secrets to make sure you get a reliable, quality product when shopping for CBD cream both online and offline. 1. Be wary of any claims. Just like other makers of health products not regulated by the FDA, CBD topical creams makers are not allowed to say that their product will treat or cure a health problem. 2. Ask for a certificate of authenticity. One way to identify a trusted CBD salve for pain is to ask the company for a certificate of authenticity. This multi-page document will tell you the product has been tested in a lab and will give a per lot or per batch breakdown of how much CBD the product contains as well as other ingredient. 3. Look on the label and determine the type of CBD being offered, isolate or full spectrum. This is important to find out because isolates typically need to be administered in significantly higher doses to be effective, whereas full-spectrum CBD is usually more beneficial and more effective at much lower doses. Follow the link in the video description below to find the best CBD cream for pain relief on the market today. You pick CBD isolate or full-spectrum CBD lotion. Pure, potent, and our cream work. Guaranteed or your money back. Order yours today with link in description.
Okay, so in conclusion, these are just a few of the holistic approaches to pain. So not everyone responds to these the same, and it basically, you do it to find out what works best for you. So with regards to CBD, as always, speak with your doctor or your medical provider about taking it and how much it take per use. If you do try CBD, and I have seen this in some patients, give it time. Everyone wants a fast-acting fix, but it's not always that. You have to give it a few weeks, maybe even less, but just give it time. Not everything works right away, and the body needs time to adjust to it. Any questions?
Well, first I would point out we have a real marijuana store coming to our area, corner of Tower Line and Palmetto Park. I just heard about so-called medical marijuana. And the other thing my observation would be that the reason we have the FDA is so that snake oil salesmen are not able to go around in a wagon and sell off the back of their wagon. So, you know, the fact that it hasn't been scientifically demonstrated to work, the placebo effect is so powerful. So,
So, two parts, I'll repeat back. So, I just found out there's a medical marijuana store coming to Boca. You said, George? I'm just repeating. Power Line and Palmetto? Right around this area. And then the second one is, you're right, there's the FDA. The purpose of it is to regulate so there's no snake oil salesmen just selling these at the corner with these products that you don't know really what's inside the CBD, whether it's a cream, a pill, or the drops. Good point. Anyone else? Anyone using CBD right now? Is it helping?
But I use a high amount of the highest amount available. In other words, 2,000 milligrams. It has, you can get lesser amounts, but the highest amount that's allowed to be sold in the stores.
Is it uses the CBD in a cream form at the highest amount? How long does it last for?
Sometimes I can skip a day. I don't use it every day.
What's the, right?
Or a headache. I have a pain that radiates through my scalp from having injections for migraines, and it left me with a pain condition. And it's the only thing that works for reducing pain in my ears and my scalp. And it's been wonderful to have it there, and I use it for arthritis in my hands. And also, I had a broken back, and I use it on my L1 area of my spine, and it kills the pain in 15 minutes.
Is it for migraines or back, arthritis in the hands, and what's the dosage?
It's the 12. It's the 2,000.
2,000 milligrams.
The higher dose.
Where do you buy it?
up the street and you go, it's a store that's across Clinchmore in that shopping center when you cross over on Military Trail. It's in the back corner. It's next. It's
There used to be a medical marijuana place at Glades and 441. I don't know if it's still there or not, because I tried it for a while, and, with a prescription.
Right, right.
I did not find it,
Didn't find it.
for me, but
But the
maybe.
higher dose.
But this is different, what you were using.
yeah, and it's a higher dose.
It was at Glades in 441.
In 441, it's right near where
Is it Shadowwood?
the ABC liquor.
Oh, okay. So in the Home Depot Plaza over there.
Plaza, but
You
it's
have-
up near it, 441.
And you tried it and it just you didn't find any effect for it.
No, and if I tried to up the dose, I got very woozy.
Oh, so it did have that, okay, yeah. Anyone else? Okay, thank you for coming.
Thank you.
Thank you.
You're welcome.